Colorectal cancer stands as the third most commonly diagnosed cancer worldwide, posing a significant challenge to global public health. Despite its alarming prevalence, it is also one of the most preventable and treatable forms of cancer if detected early. To truly understand how this disease develops, we must first examine the remarkable anatomy and biological functions of the organ it targets, the colon. The colon makes up the vast majority of the large intestine, which occupies the abdominal cavity, like a picture frame surrounding the lower central small intestine. It begins in the lower right quadrant with a sac-like pouch known as the cecum. From there, the pathway ascends through the ascending colon, stretches horizontally via the transverse colon, and descends down the left side through the descending colon. Finally, it forms a sharp S-shaped curve called the sigmoid colon, which transitions into the rectum and eventually terminates at the anal canal. While this architectural layout sounds mechanical, the biological responsibilities carried out within these structures are deeply complex. The primary function of the large intestine is to absorb the final remnants of water and essential electrolytes from digested food before waste is expelled. Furthermore, the colon serves as a vibrant ecosystem for a massive community of bacteria, known as the microbiome. These microscopic residents perform incredible metabolic tasks, including the synthesis of certain B vitamins and vitamin K, which are subsequently absorbed through the colon wall and utilized by the human body. Despite these vital functions, the inner environment of the colon remains vulnerable to cellular malfunction. Colon cancer typically initiates within the innermost lining of the organ, known as the tunica mucosa. Most cases begin when initial genetic mutations trigger abnormal uncontrolled cell division in the epithelial cells lining this inner wall. This rogue proliferation leads to small, mushroom-like growths called polyps. While not all polyps are dangerous, specific types, such as adenomatous polyps, carry a high risk of progressing into malignancies if additional genetic mutations accumulate over time. As these subsequent mutations disrupt the normal cell cycle, cells begin multiplying rapidly, ignoring biological signals to halt or undergo programmed cell death. Eventually, the aggressive tumor breaches the deeper layers of the colon wall, infiltrates nearby lymph nodes, and spreads to distant vital organs, most frequently the liver or lungs. When cancer reaches this advanced metastatic stage, it becomes exceptionally difficult to treat, which accounts for the high mortality rates associated with late-stage diagnoses. In its initial stages, colon cancer is notoriously asymptomatic, presenting virtually no warning signs. However, as the disease progresses, subtle symptoms emerge. Individuals may notice blood in their stool, persistent alterations in normal bowel habits such as chronic diarrhea or constipation, unexplained abdominal pain, sudden weight loss, or fatigue stemming from anemia. Identifying who is at risk is a crucial step in combating the disease. Age is a primary risk factor, with approximately 90% of cases diagnosed in individuals over the age of 50. Alarmingly, recent medical data reveals a rising incidence among younger adults under 55, a trend many experts attribute to shifting modern lifestyle patterns. Other established risk factors include a strong family history and inherited genetic disorders, such as Lynch syndrome, which cause polyps to form early and frequently. Fortunately, many contributing risk factors are directly linked to lifestyle choices within our control. Diets heavily reliant on processed meats, combined with a low intake of dietary fiber, significantly elevate the likelihood of polyp formation. Additional lifestyle triggers include obesity, cigarette smoking, excessive alcohol consumption, and a sedentary lifestyle. Furthermore, chronic inflammatory conditions like Crohn's disease or ulcerative colitis increase long-term risk because ongoing tissue inflammation frequently paves the way for dangerous cellular mutations. The encouraging reality is that effective prevention and early detection are entirely achievable through modern medical screening technologies. Procedures such as colonoscopies are universally recommended starting at age 45 for individuals at average risk, or earlier for those with a family history or specific predisposing factors. A colonoscopy is uniquely powerful because it does not merely detect cancer. It actively prevents it by identifying and removing precancerous polyps during the procedure. Alternative screening methods, such as stool-based fecal immunochemical tests designed to detect hidden bleeding, offer practical secondary options. To truly appreciate the critical importance of these screenings, we must understand a fundamental medical principle. The vast majority of cancer-related fatalities do not result from the primary tumor where the disease originated. Instead, mortality is almost exclusively driven by metastasis, the process by which malignant cells break away from the original site and colonize vital secondary organs like the liver or lungs. While certain primary cancers in organs like the brain or pancreas are life-threatening on their own, many tissues and organs in the human body can be safely treated, repaired, or surgically removed if pathology is caught early. For instance, diseased segments of the colon can be successfully excised if malignant cells remain localized. However, once cancer spreads to critical vital systems, survival rates drop precipitously. This stark biological truth underscores why proactive healthcare management is indispensable. Keeping up with routine physical examinations, discussing family medical histories openly with healthcare providers, and utilizing recommended screening tools at the appropriate age can make the difference between life and death. By taking these preventative measures seriously, we protect our long-term health and ensure vibrant, active living for years to come. Like and subscribe for more cognitive insights. Have a nice day.